this is probably the best job in the world.
Salt Spring is a very inclusive community for families, and it's a great place to have a career.
So my name is Bill Ralph, and I'm the Rural Site Director for Lady Minto Hospital in the Southern Gulf Islands. Lady Minto Hospital is the largest of the rural hospitals located in the Health Authority. It was formed in 1914 when Salt Spring was considerably smaller. Lady Minto serves a population of 10,000 full-time residents, and the population of the island swells to sometimes double or even treble in the summer months. We have 20 acute care beds, 29 residential care beds, 4 emergency department beds, and a small endoscopy program. We offer a full pharmacy for inpatients in acute care and residential care. We have a full lab with the exception of microbiology. We offer medical imaging. We have physiotherapy and rehab assistant that looks after both of our acute care and residential care patients. Our volunteers and auxiliary are very active in both our acute care and residential care. We are very happy to say that we actually have in-house laundry and support services, which includes dietary, housekeeping, as well as the laundry. And a maintenance crew.
I've been working here since 1986, and for 31 years I've gotten up in the morning and looked forward to coming to work. Because of the excellence in care, because of the strength of the teamwork, because of the camaraderie, and because of the opportunity to learn something new every day. This is a fantastic place to work, and I moved here not really knowing what I was going to get into, but finding out that it just totally met my need for excellence and for lifetime learning and camaraderie. The hospital is well supported by our hospital foundation and by the hospital auxiliary. We receive lots of support both with equipment and tangible things, but we also receive a great deal of support from the hospital foundation with regards to continuing education, something that's not offered nearly anywhere else.
Recognizing that rural nursing is quite a different role than many of the departments in the bigger hospitals, and it requires a lot of updating of education programs, certifications, so we recognize that as a foundation, and we've been supporting that fund.
I work at Lady Minto Hospital in the blood collection lab. What the opportunities that working on a small island has afforded me is flexibility to be able to raise my family. The rural nature of the island, the diversity with the ocean right beside my home, the mountains that I can climb, the community that I work with within the hospital becomes my outside the hospital community. You feel like a family.
I also really enjoy living in Salt Spring. It's an amazing community, all sorts of things to do here. Saturday markets, wineries, cheese shops. I find since I've moved here, lots of people love to come and visit us, and there's just never a shortage of things to do. It's a really wonderful community.
Hi, my name's Margaret Horsford, and I'm a lab tech at Lady Minto Hospital. I've worked here for 25 years. We work as a team here with the nurses and the doctors and the patients. And I was missing that working in a big lab. It's a fun place to be. There's a vibrant nightlife here too, heading into Ganges with lots of concerts and live music, theater. Even the movie theater here has nice comfy seats now. It's a good place to live.
I've worked at Lady Minto for 1.5 years. I've lived on Salt Spring for 20 years now. My baby was born here at Salt Spring. Gail Mussel was one of the nurses that was attending the birth. I love Lady Minto because we work together as a team here and help each other out.
My name's Elaine. I've worked at Lady Minto since 1989, moved over from the Lower Mainland. This has been a great move. It's a wonderful place to live. Brought our kids up here. Great school system. Living in the country. They love it. And Lady Minto is an awesome employer. It's like a little family. You know everybody in the neighborhood. They know you. They ask us about our kids. We ask about theirs. It's a great environment to be in. Miss Leah.
Hi, my name is Leah, and I've lived on Salt Spring my whole life. I started working at Lady Minto Hospital in 1979 in the laundry weekends while I was going to school. The thing that I love about working here is that this is an extended family within the staff, but also in the community. From the time I've been little and I've called people Mr. and Mrs., I now get to help them book their appointments, help them feel successful in their health care. They've watched me grow up and now they're watching my grandchildren. It's been really rewarding.
I first came to Salt Spring on a boat trip actually, when I was in grade 7. And I really fell in love with Salt Spring and I thought maybe I could live here one day.
Okay, hi, my name is Dr. Shane Barkley. I'm a general practitioner on Salt Spring Island. I came here about 12 years ago with my wife and family, largely because we wanted to have property where we could have our horses and other animals, and we had family here as well, so it was a logical move. One of the things that I've done while I've been on Salt Spring in the last 3 years, I guess, is develop the simulation lab, which is really an emerge simulation lab that we have rounds on a regular basis once a month, as well as all-day emergency simulations that involves both the doctors and the nurses, and I think has been very successful in helping improve patient care and doctor and nurse confidence in dealing with emergency situations. We've had visiting emergency physicians from Victoria come over for some of our simulation days, and they've found our system, even though we're small, quite eloquent in how we do our simulations.
After doing my master's degree at the University of British Columbia in social work, my partner wound up getting offered a job here on Salt Spring at the winery. And so it was just an amazing and unexpected opportunity for us to move here.
I've worked at Lady Minto for 40 years. My husband and I moved here back in the 70s. We've raised 4 children here and made life on Salt Spring Island.
A social work position opened up here at the hospital, and I feel really fortunate now to be able to both live and work in this community. And I think we have plans to stay here long term.
I moved here about 3.5 years ago and just took it on full on. Galliano is about 1,000 people. It's a super small community, and at the clinic we offer medical services to everybody who comes by. The small team that we get to work with, everybody that works at the clinic is part of our team. And so we meet together, we always try to make things better, try to come up with innovative ideas.
I can't believe it. It's already been a year and a half. And I love it here, working in the little treatment room, doing emerge type skills, seeing patients in my office, going and doing outreach, like yesterday when I did a smoking cessation workshop. Galliano's an interesting community, you know, quite small and rural, remote. One of the things I actually love about it is the ferry.
The high school kids go to Salt Spring Island because we don't have a high school here. And so every day they actually have to take a water bus to get there. The little kids, they get to just run around, and we call them kind of free range kids because they can just be free. You can trust everybody and you just know exactly who's around. I really like an active lifestyle, and I really like growing my own food. I'm in my greenhouse right now. It's my biggest passion. And in my personal life. The swimming is fantastic in the summer, and not to mention, I mean, I could go on for a long time, but canoeing, kayaking, it's a great place to just have as active of a lifestyle as you really want. So that's a super big plus for me.
I came to Main Island in 2010. Used to come every weekend or every second weekend as a temporary resident. And I have to say that moving here on a full-time basis has just been a tremendous experience, rewarding in many, many ways. Particularly the pace of play on Main is considerably lower than it is in the city, obviously. And the amenities and services available on this island are just super. If you want anything else, a little bit more hype, there's always Victoria that's 45 minutes away, or you can go back to Vancouver an hour and a half away. So the ferry system is 99% reliable. Every so often it suffers delays. But for the most part, living on Maine is, you can be readily self-sustained. And the nicest thing about being here are, as I mentioned earlier, the services available. And as we're standing in front of the health center, I have to say that our family physician and our nurse practitioner provide a fantastic service. One afternoon last year, I was standing on my deck and I watched the school bus go by, up Navy Channel, and it stopped. And I thought, why would it stop on the way home from school? And there's a pod of orcas going past the boat. Who can claim that? On the way home from school, I ran into a pod of orcas. It was magic.